at the desk.
The clerk will designate the amendment.
Amendment number 90, printed in Part B of House Report number 118-272, offered by Mrs. Cammack of Florida.
Pursuant to House Resolution 864, the gentlewoman from Florida, Ms. Cammack, and a member opposed, each will control 5 minutes. The chair recognizes the gentlewoman from Florida.
Thank you, Mr. Speaker. I rise today in support of my amendment, which would restrict funds at federal agencies such as the Department of Labor, Health and Human Services, Education, and other related agencies from being used to finalize any rule or regulation that have an annual effect on the economy of $100 million or more. Since President Biden took office over 2 years ago, his administration has added several billion, with a B, of dollars in new regulatory costs to the economy. Agencies like OSHA, the CDC, and EBSA often impose compliance costs and regulatory hurdles that create mass confusion for businesses and the healthcare industry. My amendment seeks to prevent these agencies from finalizing new major rules and regulations which often involve major policy decisions that should be decided by Congress, not nameless, faceless bureaucrats. By including my amendment in this bill, we restore Congress's Article 1 authority by bringing major policy questions back to the elected representatives of the people. We commit ourselves once again to open governance rather than allowing the regulatory regime to make decisions behind closed doors. During the COVID-19 pandemic, we have seen where OSHA was issuing burdensome health rules under questionable legal authority. 15 months into the pandemic, OSHA issued a mandatory workplace safety rule that required healthcare facilities to develop COVID-19 plans, install barriers between workplaces, and impose mask mandates. Once OSHA failed to finalize this rule, they sought to impose another rule covering assisted living facilities and other healthcare workers in March of 2022. This rule created even more confusion among the healthcare industry leaders, who then saw overlapping guidance and conflicting guidance within OSHA and the CDC, as well as CMS, the Center for Medicare and Medicaid Services. Now, outside the burden of compliance with these rules, violating these murky OSHA measures could land a business with financial penalties up to $15,000 per violation and up to over $150,000 for repeated violations. These penalties, in other words, could completely drown a business in costs. Furthermore, we have seen where the Department of Labor finalized a rule directing the federal government to treat climate change as a threat to workers' retirement savings. Now, sponsors of investment-based employee plans are directed to take ESG factors like carbon emissions into their investment decisions instead of strictly applying the fiduciary duties under the Employee Retirement Income Security Act. This shift to an ESG standard, as it turns out, is not a prudent investing plan at all. According to the Harvard Business Review, assets under management at global exchange-traded sustainability funds have not fared well financially. Even worse, researchers have found that U.S. companies and ESG portfolios have had worse compliance records for both environmental and labor rules than companies in non-ESG portfolios. The evidence, however inconvenient for my colleagues on the other side, it's overwhelming that hardworking Americans' retirement plans should not be subject to a radical climate change agenda at the Department of Labor. It is simple. Congress should make these major policy decisions here in the People's House rather than the regulatory regime. And with that, Mr. Speaker, I reserve.
The gentlewoman from Florida reserves. The gentleman. What purpose does the gentlewoman from Connecticut seek recognition?
Mr. Chair, I claim the time in opposition.
The gentlewoman is recognized for 5 minutes.
Thank you. I rise in strong opposition to the amendment. This amendment is absurd and would bring the Medicare program to a standstill. If this amendment were to be enacted, Health and Human Services would be prohibited from finalizing rules for paying physicians, hospitals, nursing homes, or any other healthcare supplier or provider, which would throw the Medicare program into chaos. Now, I know my colleagues on the other side of the aisle don't really like Medicare, but now they want to throw it into chaos. By law, Medicare issues annual sales that govern how it runs the programs and pays for services that Medicare beneficiaries need. These rules are always major rules of over $100 million, and they happen by law several times a year so that Medicare beneficiaries know the rules of the programs and providers know how they will get paid for the upcoming year. If this amendment were enacted, Medicare would not be able to pay physicians or hospitals or new services. Medicare would not be able to pay for new drugs or devices. Medicare would not be able to pay rural hospitals that depend on Medicare to stay open to serve beneficiaries in rural areas. These rules always exceed $100 million because they govern how Medicare pays for services for its 60 million beneficiaries. In short, this amendment would cause a massive disruption to health care for millions of seniors and individuals with disabilities. The amendment is not a serious policy proposal. It really is a campaign slogan. I urge my colleagues to oppose the amendment, and I reserve.
The gentlewoman reserves. The gentlewoman from Florida is recognized.
How much time do I have remaining, Mr. Speaker?
The gentlewoman from Florida has 1.5 minutes remaining.
Thank you, Mr. Speaker. I don't know how else to quite say this, so I'm just going to lay it out bluntly. That is a lie, what was just spelled out. The notion that CMS will cease to operate because they do not have the capability to just issue regulations at random or at will is nonsense. I think it is absolutely absurd that the representatives of the People's House do not have a final say in major economic implications for people who utilize Medicare. I think it is ridiculous that if you are a physician, you have to go through your member of Congress to get in touch with CMS. When we talk about nameless, faceless bureaucrats, we're talking about this amendment, which would fix not only the financial burden that people have to bear as a result of an overactive regulatory regime, but restoring the open accountability process here in Congress. This is the People's House. We should be absolutely responsible for the impacts that every single one of our constituents has to bear as a result of the work that is being done here on Capitol Hill. If you pick up the phone and call CMS, you can't find a single person who will answer that phone. You cannot call up OSHA and ask for answers. You cannot get answers out of the federal government, which is why half of the team that we employ in Congress is based back home in our districts in order to liaison with these federal agencies. We have got to restore accountability, restore Article 1 authority, and with that, Mr. Speaker, I urge my colleagues to pass this amendment.
The gentlewoman from Connecticut is recognized.
I continue to oppose this. The information, I just didn't make it up. I don't know where the gentlelady's information is coming from. This came from the Ways and Means Committee. I'm not making it up. It's not anecdotal. Amendment enacted, Medicare not be able to pay physicians or hospitals for new services. Medicare not be able to pay for new drugs and devices. Not to pay rural hospitals that depend on Medicare to stay open to serve beneficiaries in rural areas. Because these rules exceed $100 million. Because they govern how Medicare pays for the services for the 60 million beneficiaries. We have that information. I do not know where the gentlelady has received her information, and I suspect maybe it's not understanding the scope and the reach of CMS and its oversight of Medicare beneficiaries and the services that they need. I oppose the amendment, and I yield back.
Gentlewoman yields back. The question is on the amendment offered by the gentlewoman from Florida. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to. The chair understands that amendment number 91 will not be offered. It is now in order to consider amendment number 92, printed in Part B of House Report 118-272. For what purpose does the gentleman from Arizona